Good morning, students. This is Dr. Anaga Agarwal from the Department of Public Health Dentistry in PDCH. I am working here as a reader. So, in my first part, we've just discussed about the general epidemiology. So, what do you mean by epidemiology? What are the principles of epidemiology, the various tools of epidemiology? What are the aims of the epidemiology? Rate, what are the rate ratio proportions or the measurements, that is mortality and morbidity? Now, from this lecture onwards, we'll be going for one studies of uh, the general epidemiology or the research studies or the research designs that we need to learn so that we can ultimately choose the perfect design for us research to get a maximum benefit out of that research. So, So just to give you a brief idea about what are the different epidemiological methods. So very first is observational study. So epidemiological methods can be divided into two, that is observational studies and experimental studies in its broader sense. So the observational study, as the name suggests, is just the observation of the people. So whatever research you want to do, you cannot just disturb the life of the people. You cannot give them something or you cannot ask them to leave something. You just have to be besides them and you have to observe and then you have to come for a conclusion with that study. You cannot just interfere into their day-to-day activity. That is the observational study. And second is the experimental studies where you actually experiment with the people. You change their environment. You give them something or you remove something from their day-to-day life. You ask them to do something which they do not do in their day-to-day life so that there will be an experimentation and ultimately you will come to know what will happen if the things are done in this way. Okay, so this is the broader classification, that is observational study and experimental studies. Now the observational studies can also be divided into descriptive study and analytical study. Okay, so descriptive study, again as the name suggests, it just describes the condition, just describes the condition which we actually today gonna learn. It just describe the condition, whatever happens in that particular area. Like what is the age ratio? That means how many are children, how many are young people, how many are adults, and like sex ratio, how many are females, how many are males, how many are educated, how many are not educated, how many people have dental caries, what kind of a caries they have, or periodontal diseases, and what are their healthcare needs, what kind of a water they are having. So just describe the situation. Whatever situation is there, you just have to describe that particular situation. That is your descriptive study. So there is no need of any hypothesis in this. So you just describe the situation. So we'll be seeing this study in detail in further in this lecture. Second is the analytical study, means you just not describe the situation, but you actually come to an inference with the help of whatever you are seeing. So you describe this situation, you make one or two groups, then you analyze what happens in one group, what happens in another group, and you actually do some statistical analysis to find out what was the difference between the groups. So that is about analytical study. Still, since both of them are part of observational study, we cannot interfere with the life of the patient. We cannot give them something or remove something out of their life. The second, that is the experimental studies, those are also again can be divided into two. That is randomized control trial and non-randomized control trial. Okay, so randomized control trial, uh, since it is again an experimental study, you have to intervene with the day-to-day life of the patient. In randomized control trial, it is the most effective and most uh, acceptable way with which you are experimenting, and whatever result you get out of randomized control trials are always acceptable with less amount of error. What does this really means? Randomization means the patient were not knowing in which group they are, or the patients, even the observer, they do not know in which group the patient will go. So every patient have equal opportunity to be selected as either case or a control group. So that is randomization. Randomly, you are taking patient into either in a test or a control group. Second is non-randomized trials where the non-randomization. The randomization is not there due to some limitations. Due to some limitations of your study question, the randomization cannot be done. Okay, so that is called as non-randomized trial. May they not be as good as randomized control trial, but in some situation you may not randomize people. For example, if there is some calamity, some disaster, you have to take people who are there into that situation only, then only you can do your study. So at this point of time you cannot randomize patient, you cannot have general population and randomly you can select. You have to select that particular population only to find out whatever problems they are facing, right? So in such case non-randomized control trial is preferred. Okay, so this was just a brief about all the epidemiological methods. Now we'll be going one by one. The very first observational study, out of which the very first, that is the descriptive study or descriptive observational study. So what are the steps? They are defining the population to be studied, defining the disease under the study, describing the disease by time, place, and person, measurement of the disease through cross-sectional or longitudinal study, comparing with the known indices, and formulation of etiological hypothesis. So one by one, defining the population to be studied. So according to your research question or whatever thing that you want to find out. So if you want to find out how much is the amount of dental caries in younger children into your community, whatever community you want to refer to, so you have to go for that particular population. You have to go and see population which is under 5 years. Okay, so that is your population. So you have to define that population, that my population consists of 5-year old children residing in this particular area, right? So that is defining the population. Second is defining the disease under study. So once the population is defined, you have to define your disease. You have to define your disease means you have to have an operational definition, which is saying how much part will you consider disease and how much part you do not want to consider the disease. This is not the actual definition which is given in the book, but this definition is created by you so that you can have proper cases into your uh, study. So what do you do? For example, if you want to study only nursing bottle caries, okay, there may be children who are having caries into that particular community, but you want to study only those children who have nursing bottle caries. So this is your defining the disease. Even if the children are having many types of caries, you will be including only those children who have nursing bottle caries. So you have defined your disease only as nursing bottle caries and the criteria which are following it. So that is defining the disease. Then describing the disease according to the time, place, and person. So how much time, the duration the disease takes, what is the place which is most common for that particular disease, and what is the personal what do you say, personal grounds, or what are the personal parameters on which this disease is more common. For example, in which age it is common, that is for children, or which sex it is more common, whether it has something to do with occupational status or socioeconomic status. So that all comes under describing this disease under study. The next is measurement of disease using either cross-sectional or longitudinal data. So depending upon your research question, whether you want to go for once only, that is cross-sectional, once only, you can interview one person at one time. So that is only cross-sectional study, or longitudinal where you have to go again and again and collect the same data. So that is the longitudinal study. Depending upon your research question, you have to decide it. Then comparing with the known indices. Once you know, how will you compare that disease? Now, randomly, you cannot just say that this person is having high amount of disease, that person is having low amount of disease. But there are some indices for every disease to designate how much is the amount of disease into that particular person. So according to your research question, according to your disease that you are considering, you have to take index into consideration and you have to check all the people using that index. And finally, formulation of etiological hypothesis. Once you get all this data and you arrange that data, you'll come to know what may be the etiological factors for that particular disease. Why this disease is more in this particular community, right? Why this disease is more in this particular community. So accordingly, you can frame a hypothesis. See, descriptive study do not have any hypothesis. Descriptive study is meant to prepare a hypothesis. Okay, so once you gather the data, by looking at the data, by doing some arrangement of the data, you can come to know that these may be the risk factors for that particular disease. So with the help of that, you can make an assumption, that is hypothesis, make an assumption saying that these may be the risk factors for that particular disease. Okay. So now one by one in detail, we'll be seeing all these steps. I have just given you an idea of what all are the steps. Okay. So very first is defining the population to be studied. So how do you define the population? You should know the total number of the people you want to study on and the composition of the population that I have already explained, like how many school going children, how many small children or infants, how many people who can earn, how many are aged people, what is the dependent population, what is the independent population, what is, so all that. Then it may be the total population or a representative sample. So the example that we have taken about nursing portal caries, in this we cannot take the entire population into consideration. So we will be having a representative sample from which we'll be getting our results. So that representative sample we have to take from those small children, children below 5 years, right? So the entire population we're not taking into consideration. Maybe special groups like school children, factory workers, hospital patients, etc. should be large enough. So sample size should be calculated with the help of a formula, and that should be fulfilled. The sample size should be fulfilled. There should not be less samples assessed than whatever is your sample size. Okay. Then should remain stable over a period of time, should not move here and there. And this is your defined population. Once you get all these things, this will be your defined population that is entering into your study. Then the second step is defining the disease under study. Whatever disease you want to study. So we've taken again example of nursing bottle caries. So that is our definition. Clinician may need a precise definition of disease which is acceptable and applicable for the population. So this is not, as I've already told you, this is not a book's definition, but the definition which you want, the definition in which you want those patient to enter into your survey. So this is your own made definition according to your research, where you want those particular criteria to be assessed into that particular population. That's why it is not called as definition directly, but it is called as operational definition. Just for the sake of research or making this definition, that's why it is called as operational definition for that particular research. Okay. Then describing the disease. So first part is by time, by week, month, year, or day of week, or hour of onset, etc. When did that disease start? How many time that disease has taken to take its full blown activity? Did whether that disease subsided or whether there is a death happened? So this all you have to, whether that is an acute disease where it appears within 3 to 4 days, or what like diabetes or dental caries, whether that is a chronic disease which goes on for decades. So that is the time where you have to describe. If disease is seasonal, whether that disease is seasonal occurrence, like for flu, whether there is periodic increase or decrease in that particular disease. That means, for example, dental caries follows a consistent time trend, whether there is a consistent time trend for that particular disease. There are three types of fluctuation. First is short-term fluctuation, that is epidemic, like what happened in Corona. So Corona came for a short period of time, just for 2 years. It was not there. It appeared suddenly and went off suddenly. So that is a short-term epidemic. Then there are periodic fluctuations where there are seasonal trends, like in measles, varicella, upper respiratory tract infection. We can see it in every winters, or malaria when we can see it in monsoons. Cyclic trends like measles in the pre-vaccination era appears in the cycles with major peaks every 2 to 3 years, and rubella every 6 to 9 years. Since we've started with the vaccination, we do not experience the peaks of these diseases now. Long-term fluctuation, like over a long period of time, for example, coronary heart disease, lung cancer, and diabetes, over decades, these diseases do not happen in just 1 or 2 days, but they go on for over decades, and they destroy each and every organ of your body eventually. Okay, so that is the describing of the disease with the help of time. Now, place distribution, where it exactly happens. What is the particular place which is more susceptible for that particular disease? So, geographical variation of the disease gives important clues about the disease etiology. For example, in hilly region, we can find that there is high amount of goiter since there is iodine deficiency. So this is the geographical variation. Or for example, dental variations in Gujarat, as we say, there is high amount of fluoride in the crust of the earth. So there is high amount of fluorosis in people. So that is a geographical variation by virtue of people staying there. They're having that particular diseases can be studied under international variations, like some diseases more common in some other countries, or infectious diseases are more common in underdeveloped countries, and modernized diseases are more common in modern countries. Then national variations, as I've already given you an example, like in hilly area there is a iodine deficiency, whereas in flat areas there is no iodine deficiency compared to it. Rural and urban variations, again the same, where rural areas they have more of infectious diseases, whereas urban areas they have more of modern day diseases. And local variation in that particular area, if one area is having high amount of fluoride into water, whereas the other area where the amount of fluoride in earth's crust is less, so there will be less amount of fluoride into their drinking water. Okay, so this is about place distribution. Then we have person distribution. Now, what are the personal things? What are the personal parameters because of which you become susceptible, more susceptible or less susceptible for particular disease? So, for example, age. Okay, so as the age advances, immunity decreases. So, people become more and more susceptible towards infectious diseases or modern day diseases. Then second is gender. So some diseases are more common in some gender. For example, whichever diseases are related to pregnancy, like hormonal changes, which happen during pregnancy and puberty. At that time, gingiva becomes more susceptible for inflammation in females. So this is a sex or the gender dependent disease. Ethnic groups, some diseases are common in some ethnic group by virtue of their genetic makeup. Then occupational diseases, like there are more and more carpenters who hold nail into their teeth, and because of which there is high amount of attrition in their anterior teeth. Then socioeconomic status. So people, low socioeconomic status people, as we know, that they are less aware of the disease process, and they do not believe in preventing disease, but they believe in cure of the disease. Until unless they have some problem with that disease, they won't be going to a healthcare professional. Whereas high socioeconomic status people, they're aware of the disease condition and they believe more in prevention. Then the marital status, some diseases are more common in unmarried people as compared to married people. And behaviors, various lifestyle behaviors like smoking, keeping hygiene, drinking, dietary habits. So this depends upon person to person. If you acquire good habits, there will be less amount of disease for you in future. So this is the distribution of the uh, diseases. Whatever disease we have thought of, we are describing now the disease under these three headings. So firstly, we have actually described the population. Now we have described the disease. Now, whatever disease that we have described, we have to measure how much is the amount of that particular disease using a cross-sectional study. It is based on a single examination of cross-section of population at one point of time. So cross-section means a cross-section in time. Only at one point of time, you just take a cross section, means you just go to people once, take whatever information you want, just one interview, and extract whatever information you want, and you actually rely on that information, and that information is finalized. So this is done in prevalence studies. and provides information about the natural history of that particular disease. Whereas longitudinal studies, where the observations are repeated in the same population over a prolonged period of time by means of follow-up examination. So again and again, once you gather some data, again over a period of time you go and see how much is the progress or regress of that particular disease. Again you go and again you check what is the progress and regress of that particular disease. So over a period of time you go to the person more than once, so that's why it is known as longitudinal studies. This is done in incidence studies and uses being to study the natural history of disease and its future outcome, and for identifying risk factors of the disease and for finding out the incidence. Okay. Now, once you know which kind of a study, longitudinal or cross-sectional, you want to do, what you have to do, you have to take some indices to find out the magnitude of that particular disease, and then to compare the whatever amount of disease or the magnitude that has come with the normal or the national parameters which have been already laid down by somebody else. So once you take indices, you get to a number for that particular community, that this community have this much magnitude of disease. So with the when you compare it with the national normals, you can find out whether the disease is, whether it is in higher amount in that particular community, or it is in normal amount, or it is in less amount. So in both the cases, if it is in higher amount, you have to find out the risk factors why this disease is appearing in so much higher amount in that particular community. Or if it is in lower amount, then you have to find out what are the restrictive factors or what are the good factors this community has, because of which there is a low amount of disease in this particular community. For that we need some indices. So comparison between different population or subgroups of the same population you can do, or to identify groups or subgroups who are potentially at high risk for development of the certain diseases. So indices depending upon your condition, depending upon disease that you want to find out. Like for example, I was giving example of nursing bottle caries. So you can have small DEF into consideration. That was just an example. You can have many more indices. So ultimately, now you have a data. Now you have found out that this disease is, for example, in slightly more amount in this particular community. And you have found it during your interview, you have found out their lifestyle habits and every other thing. So you may have this assumption that because of this particular problem, this community is having high amount of disease. For example, if the oral hygiene is not kept proper in that particular community, there is high amount of disease. Or for the example that I have given, this community gives a bottle, milk bottle with sugar, milk with sugar to the children in more amount, so that they have more amount of nursing bottle caries. Okay, so this is my assumption. This is my assumption that I have found out that in their behavior, they're giving more amount of bottled milk to the children. That's why the community is having high amount of. Good morning, students. Uh, I am Dr. Anagha Agrawal. I am